Thanks, Mandy. So firstly, welcome everybody to our second panel discussion. So today's topic is the practicalities of research in the work and health setting. My name is Nicola Suckley. I'm an occupational health physiotherapist and a board director at the Council for Work and Health. So we've got a great lineup on our panel this afternoon. Firstly, we've got Ali Hashtroudi, who's head of the National School for Occupational Health. We've also got Vaughan Parsons, who's a research manager at the London Centre for Work and Health, and Glykeria Skamagki, who is the senior lecturer in physiotherapy at Birmingham University, and also the research lead at ACPO, which is the Association of Chartered Physios in Occupational Health and Ergonomics. So in terms of the proceedings for today, I'm going to ask, first of all, for the individual panel just to introduce themselves a little bit more and give us a little bit of background of their experiences within their individual settings around research within work and health. Can we just ask that everybody please put themselves onto mute if that's possible. So I'm going to hand over to the individual board members, panel members, first of all, just to kind of introduce themselves and give us a bit of background from their individual settings. And then we've got some core questions that we're going to kind of work through. But as Mandy said, we do really welcome questions from the audience. And if anybody has anything that they'd like to discuss, we really encourage this to be quite an interactive discussion as well. So please do put your hand up, and Mandy will flag this to us. So I'm going to hand over first of all to Ali. If you could go first, please, Ali.
Sure. Thank you very much, Nick, and thank you for the council to invite me. As I was introduced, I'm the head of National School of Occupational Health, but I'm also a jobbing occupational physician at Guy's St Thomas's. So I've got my hands in both pies, if you will. I was tasked to talk about the national context, and I was thinking to talk about the training and the research element in that. But in between deciding to do this question and answer, and today, obviously, we had the spring budget coming up, which to our pleasure in occupational health world, there was quite a lot of attention and budget allocated to occupational health nationally. Therefore, I thought it would be better to actually expand the national agenda outside the training and actually start from that point. So those of you who are interested enough to look at the budget, you will see there is a lot of interest and funding now made available to occupational health. There are different areas, whether it is opening the door to SMEs under the well work, or doing more research into the subject, or other areas. There is certainly a desire within the government to improve access to occupational health. That inevitably means that there is more opportunities for research and development. Whether we want to just answer the consultation, as there will be lots of consultation to implement the budget, or whether we want to research on the best delivery model, either way, there would be some opportunities to actually deliver some research. And surely we cannot use that funding, or in fact persuade the government to continue funding occupational health without producing credible data, which obviously would be only available to either research or proper quality assessment. The other part of the national agenda is obviously, like any other specialty, we have to be mindful of our audience and the customer we serve. And without having adequate data in terms of what is that they need, it would be difficult to actually design a good service. So if you look at the sort of the main sort of items that are coming up, for example, if you think about the aging population, if you think about long-term conditions and comorbidities, other emerging problems, I mean, long COVID is one of them, other infections coming up. If you think about different ways of working, so people are moving from the old-fashioned one job for life to a portfolio career or gig economy. So all of these things will have significant impact on occupational health. And we cannot deliver a good service unless we understand how those things affect occupational health and what the demands are, which again goes back to the original idea of it has to be evidence-based. We cannot necessarily justify transferring these skills and our knowledge from what we learned 20 years ago to now for the reasons I mentioned. I think the other part is, again, very much aligned with the national agenda in terms of providing occupational health to more people, to an aging population with long-term conditions. It's actually focusing on the outcome. Historically, we have focused a lot on delivery and on process, because that is usually, relatively speaking, a low-hanging fruit. It's easier to measure, whereas we've been apprehensive to look at the outcome of occupational health, because there are multiple factors. Often there are long-term outcomes, and it's very difficult to actually measure them. However, it is an opportunity now with the national interest, and hopefully with more academics like Dr. Parsons and his team coming up to look into outcome, which then hopefully enable us to provide a better occupational service to population. Finally, I finished with what I was supposed to talk for the whole 5 minutes, which is from a training perspective as the head of the school. Those of you who are from the specialist medical training background, you know that we used to have a dissertation within the curriculum. So all doctors who were trained in occupational medicine ought to have done a dissertation. With the new curriculum, it has changed. I would say it is a positive change, because it has released people from doing a dissertation, but reiterates on the importance of research. So we still need to deliver a research as part of training, but that research is not necessarily a dissertation. It could be another form of research, which I think probably enhance our research portfolio in general. What we would like to see in the future is that becomes a requirement for all specialties. So as you go, and if you're a physiotherapist or if you're a nurse and you do another qualification in occupational health, we would hope that research, at least understanding research, becomes an element of that qualification for obvious reasons. So I will stop there, Nick, because I suppose I was supposed to have 5 minutes. So I stopped there. Hopefully I stuck to the time.
That's fine. Thanks very much, Ali. Okay, so I'm going to hand over to Vaughan now. So Vaughan, take it away.
Thank you very much, Nick and Ali. Hello, everyone. I'm Vaughan Parsons. I'm the research manager at the London Centre for Work and Health, and based in the Occupational Health Service at St Thomas's Hospital, and work alongside Ali. As most of you may recall, myself and Ira Madan attended the last council meeting, and we spoke about the recent launch of the London Centre for Work and Health. And really, just to kind of recap, the purpose of the London Centre is really around trying to build research capacity for work and health research, both within occupational health, but also outside of occupational health as a specialty as well. So certainly the work that we do at the London Centre for Work and Health is focused, I guess, on 3 interlinked areas of expertise, if you like. So given we work within occupational health, a lot of our research work is very much focused on looking at some of the clinical effectiveness of service provision within occupational health. We've also drawn upon the expertise of our colleagues at King's College London as well, who have expertise in occupational psychiatry, Jo Feary and her team at Imperial around occupational respiratory conditions, and we also do some work around data linkage as well. I think it's important also to give recognition to the various other research groups that exist across the UK who have a particular interest and expertise in work and health research. So we have the group at Keele University, who is headed up by Gwen Wynne Jones, and they certainly focused on interventional studies within the primary care setting, if you like. So there's been some various trials that have been underway in recent years, looking at providing return to work support to patients with MSK conditions and also non-MSK conditions. There's also the Centre for Musculoskeletal Health and Work that's hosted out of the University of Aberdeen. That's led by Professor Gary McFarlane and Karen Walker-Bone and Ira Madan as well. And that's a joined up centre involving various academic institutions across the UK. There's also Ewan McDonald's group in Glasgow, which is the Healthy Working Lives group, and also Marty Van Tongen at the Centre for Occupational and Environmental Health as well. So it's important, I guess, to just recognise that there are various groups who exist in the UK, but I guess collectively our aim is really to try and build upon and grow the research base and evidence base within occupational medicine, but also in other disciplines as well. There's also the Academic Forum for Health and Work in the UK that Ewan and Nick host, if you like, through the SOM. So there are various different pieces of research activity, if you like, that are ongoing. So this is a really exciting opportunity for us to come along here today at the council and just to talk about the issue around research within work and health research and how we can try and support people who are interested in doing research.
That's great. Thanks very much for that, Vaughan. It's great to understand the different areas where people are carrying out this research. So Glykeria, can we hand over to you? We can talk a little bit about what's happening in the universities and perhaps in the professional groups.
Yeah. So hi everybody. My name is Glykeria Skamagki. I'm an assistant professor here at the University of Birmingham. And I think the two previous speakers have actually said a lot about what I was going to say, so this is great because I don't need to repeat myself. So I'm just going to say a little bit about, as Vaughan discussed, more about the university work. And I think the key element from here is that the universities now are really looking into the occupational health. They're looking to enhance the research arena and the profile, especially after the governmental bodies are actually producing and allowing us to apply for funding and to be able to support the well-being of the workers. One of the great things that we can see is that now those calls require for more public involvement. They require for more healthcare professionals to be part of our networks for our research. So it's not just academic and researchers, but it's very important to involve people who are working with those patients and those employees. So I think this is quite good for us to understand why it is really important, the topic of the panel today, to discuss what is happening with research and how clinicians can produce research. My other profile goes to the association we have with the physiotherapists working in occupational health and ergonomics, so with ACPO. And I think what we have tried to do and what we started to do in this year is to support our members with producing research and getting involved in the research. We're doing a little bit of webinars, like our research cafes online. So we're trying to support our members to get involved. And I think this could be something that maybe other healthcare professionals can do and get their members to get involved into that. So it's a good opportunity to just share good practice in making sure that we are all up to date and skilled enough to be able to learn and implement that research, because it's good when we do it, but then it doesn't have to stay there. It needs to be implemented into the job we're doing. So we'll leave it there because I think we're running out of time anyway.
Thanks, Glykeria. And that nicely moves us on actually to our first question. So I want to put this out to the panel, really to understand, how do we feel research is being carried out currently in the field of work and health? Who'd like to go first? Vaughan?
Yeah, sure.
Yeah, go for it, Glykeria, that's fine.
Yeah, so I think from kind of taking what I've said before, I think at the moment we're looking at there is a growing recognition of the occupational health research, and this is fantastic. We have many organizations and bodies who are really trying to address some of the work-related factors, and they're really key, obviously, to understand the impact of those in the health outcomes, and we need to identify strategies to promote a healthy work environment. What I think, and I see from my point of view in my role, is that definitely we have the academic staff who are looking to identify these opportunities. There are clinicians that are getting on board slowly and steady. And as I said before, some of the public engagement groups and charities who are supporting the kind of the research arena. But what we see, I think, and my colleagues here will support on that, is that we are starting to boost that now. So I think this is quite good to have a look who else wants to get involved and how we can actually promote more what's happening in the occupational health setting.
Yeah.
And I can add on to that, really. I suppose, as I mentioned in my introductions, we know that currently there are some very research active groups that exist in the UK who have a particular interest in work and health research. They've been very successful in securing funding to do this work. I think one of the challenges we have, and we'll cover this off in a bit more detail, is how we actually engage better with our clinical colleagues within occupational health, but also in other specialties as well. And I think there's some work to be done around merging the research groups and research teams, and so there is that better integration with the clinical setting, if you like, within occupational health. I think in recent years there's been a lot of lobbying that's been undertaken quite successfully, really, to raise the profile of work and health research, and certainly that's now translated into specific funding calls that have recently been advertised, for instance, from the National Institute of Health Research, specifically looking at the issues around workforce health and work and health research in general, and that's very encouraging as well. There's also been some work done when we look at some funding opportunities to support clinicians who are interested in doing research in this area. So this is some funding through the Colt Foundation and the National Institute of Health Research, whereby clinicians can quarantine or have some protected time to do some research. And historically, that's been very difficult for frontline clinical staff who have been interested in doing research. So I guess overall, I think things are improving, albeit slowly, but I still think there's a lot of work to be done, particularly how we engage with our clinical colleagues.
Yeah, I agree. And I think it's not an uncommon thing that happens where we're starting to have some great research going on, but how do we actually really embed that into sort of clinical practice and engage the clinicians in it? So, panel then, yeah.
Sorry, if we can just add to that. I mean, first of all, I'm conscious that some of the answers to this question will significantly overlap with others, so I try not to sort of jump the gun. Just to pick up from previous panel members, I think there are a few things to consider. First of all, if you look at the current picture in research, it is not confined to occupational health. In fact, I think the majority of our research is actually being done outside occupational health. So you've got other specialties who are interested. A lot of research is actually being done not necessarily in the conventional clinical setting. So you're not talking about a physiotherapist or an orthopedic surgeon. You're talking about people who are, say, for example, undergrad psychologists are interested in doing something or else. But also you have people who are far from clinical setting. So you know the government bodies have interest in this now. So you've got DWP and the DHSC commissioning research on delivery of occupational health, access to occupational health. And all of them are actually good questions. So if your question is about what is happening on the ground now, we have a plethora of occupational health, clinical non-occupational health, academic non-occupational health, non-clinical, and else, all working in the same area. One of the things that I was going to mention on the barriers or what you want to see is it is such a diverse plethora that actually most of the time we don't know what the other person is doing. And I think it is having one way to inform each other of what's happening and what research is being done or in fact concluded will help enormously other researchers to actually to sort of learn from it. Personally, I'm a subscriber to the chain email, and it's a good sort of resource to say what's happening. And 9 out of 10, I had no idea this person is active in that area or that group is interested in occupational health, and you learn an awful lot. So I think the picture is encouraging. There are a lot of people with or without clinical hat on interested in occupational health. The challenge is just to make sure we actually know or reasonably know of each other endeavor and learn from it. The second point I wanted to raise is in terms of, as I mentioned, what's happening now, there is a requirement within training in occupational medicine to deliver a research project, but that is a very, very small one. So if you think we've got about 50 trainees, 10 of them graduate a year, that's 10 pieces of paper, if you will. If we can extend it to other specialties, that would be wonderful. And also, a lot of our colleagues encounter problems. Rather than trying to set up a research to answer it, you just try to either Google it or go and ask someone else to do it. So I think military is a very good example. They actually do a lot of research to answer their questions. So I think that is something to learn from, that if you, I don't know, if you create a new tank and it causes body vibration, how you're going to answer that? They actually go and do a piece of research, which is very interesting. So I think it's important to know what each other are doing and learn from it, really.
Thanks, Ali. So with that in mind then, question for the panel would be, how do we try and support clinicians to become more active in actually engaging in research within their practice? Glykeria, do you want to take that?
Yeah. So I think there are a few things we can do. So I think one of the first thing is to try to develop a culture of research, so we can encourage the healthcare professionals who are working as clinicians to be able to seek for evidence, to inform their decision making, to be able to learn more about, you know, the research methods and the findings and understand how they can implement it. So to not be afraid of that and be able to ask those questions. Obviously, to do that, we need to be able to support and provide some maybe resources and infrastructure for those research activities. So I guess some of those things will be for them to find opportunities, to do some research training, and to be able to engage with these activities. And then obviously something that needs to happen with collaborations, which is between the researchers, the academics, the professionals and the workers. So we have to be able to support them by providing these collaborations and inviting them to do research. So for instance, from my point of view as an academic and as a research officer in one of our associations, we should be able to provide them with these opportunities to learn and to be able to get involved. And obviously it's then about, okay, if we do have the findings, how can we support them to become more active in implementing this research? So it's about what is the impact we create. So it's not just the articles that are published, but let's make them into guidelines, toolkits, training programs where they can get involved.
Okay.
I suppose I can add on to that, really. I think as researchers in work and health research, we have a role to play in terms of offering that mentoring support to our colleagues who are interested in doing research projects at a local level. I guess we recognise that there perhaps is scope to try and improve the education and training to our clinical colleagues around how to do good quality research within the context of their clinical practice. And certainly those who work within the NHS, particularly at large NHS organisations, quite often their local R&D departments will run various research methods, training courses for staff to go along. These are very short courses. They might just go for a couple of hours or half-day training courses. But also, I suppose I would encourage people to tap into local resources in the first instance. reach out to those of us who work in health and work research, just to get that kind of support if they're interested in taking it forward, but also kind of exploring any funding opportunities that are available. I mentioned the joint fellowships that are available through the Colt Foundation and the National Institute of Health Research. You know, this is a really valuable opportunity for people who are interested in actually having protected time. This is up to 2 days per week to focus on doing work and health research. So really exploring those opportunities that are available to people.
Ali, do you want to add anything into that?
Yeah, sure. I think probably I start with slightly more basic than the previous colleagues. If you're thinking about changing culture and encouraging people to do research, first thing is for them to remind them that the benefit of research. I think, as I mentioned earlier, that you always encounter questions in your practice. What we're missing is people actually look at it could be a potential research. So the basic point is to remind people that research can happen at any simple interaction with your patients or any simple questions that you come up with. The second point is, I think Vaughan is right about the funding and NIHR and BORF and COLT and the rest of it. But actually, I would say looking at the grassroots, dealing with junior colleagues in occupational health and trainees, that is not the primary obstacle. The primary obstacle is a general fear of the word research, and you think as soon as you say research, you ought to write an 80 pages proposal and then go and defend it. Whereas you just need to say, well, research could be a very simple question and not a simple exercise, but not as complicated as an NIHR proposal either. So I think I would focus on talking about the benefit of research and simplification of doing a research or a study. It doesn't, not all the studies need to be funded or need to be as complicated. Then it comes to resources, I think colleagues were discussing. Obviously, some research you can do out of interest and just squeeze them into a Friday or a Saturday, and then you just get on with it. But mostly you need to have proper resources. So whether it has to be within your job plan, if you're a clinician and have a job plan, you need to think about funding, simple funding for the time, not necessarily doing a massive, bench kind of research. So I think the elements to cultivate the culture, to me, is, as I said, reminding people of the benefits, simplifying it, then we can think about the resource.
Thanks, Ali. Vaughan and Glykeria, have you got any other comments about perhaps obstacles for clinicians to be able to engage in research?
I think the biggest obstacle probably is the time constraint. So, clinicians do have quite heavy workloads and they maybe struggle to find the time to engage in research activities. So that's very understandable. But I think sometimes could be related to the research skills and the training, and it's about what Ali have said, that people are listening to the word research and then they're afraid of that word. They don't want to get involved more, but they have done a degree, they have some knowledge. It's about maybe trying to support them on getting back some of those research skills and get some of their confidence to the ability to design or conduct some research studies. And then I guess maybe the opportunities for funding are now getting higher. They used to be quite limited maybe in the area. So sometimes the clinicians might not find the relevant resources, or they might not have the proper connections with the staff to support them in writing an application or getting involved, or they might not have that institutional support that we have to engage in research activities. And maybe, in the end of the day, the patient care sometimes comes a bit higher from providing, the best quality to patients from doing the research. So it's about the role and what they feel they put priority into. We know how difficult it is in the hospitals these days, and that's another problem that can lead to not engage with research.
And I just wanted to add on to a point that Ali raised, and this was around recognizing the value of research within the specialty, but also within the wider context of work and health research. I would encourage people to actually give some thought to how they can contribute to building upon the evidence base within occupational health. And so some practical suggestions could be to think about whether there are any local service evaluations or clinical audit pieces of work that have been undertaken at a local level that people may wish to write up as a short report, for instance, for the Yellow Journal, just to disseminate some of the work that's been undertaken locally. If I look at some colleagues who work in occupational health services in the NHS in England in particular, I can identify a couple of departments who are really research active, who regularly publish their work in the Yellow Journal, for instance. So these are people who are not necessarily doing pure original research. They're doing other pieces of work such as service evaluations or clinical audits that, to my mind, would be very useful to disseminate to the wider colleagues.
Excellent. And have any of you got any pointers for the audience in terms of those that might just be working in clinical practice that might want to just develop their research skills a little bit more? They're perhaps not wanting to go as far as kind of further education. Is there places for people to go that they can access this sort of support?
So I would encourage people to think about what their research interest, ideas, or research questions look like, to think about and to identify the research teams across the UK who have expertise in these specific areas and actually link in with them. So as I mentioned in my introduction, one of the aims of the London Centre for Work and Health is to build research capacity in our three kind of core areas of expertise. And part of our role is we see our role as providing that support and guidance to people who are interested in doing research, who are perhaps unsure about how to take those next initial steps to do that. I think, as has already been mentioned a few times already, think about if there are any short courses that people can go on to try and build their skills and training in doing research, such as research methods training, just to give them those foundation knowledge to support them in moving forward.
Yeah, it's important, isn't it, to be building that confidence. I know, Glykeria, some of the work that you've been doing at ACPO, you mentioned earlier about the research cafe is certainly one of the main objectives for that.
Yeah. I think one of the opportunities would be for people to look at research network. So ACPO has done the research ACPO Cafe, where we are trying to engage with clinicians who are interested in research. We're trying to accommodate needs, so we can do some webinars about what is currently out there, but also we have done previously in the past webinars about how to critically appraise an article, if they need some support in understanding some of the stats. So I think for clinicians, it would be important to look also in their associations and see what support do they offer. Can they get involved with such kind of opportunities for networking? But I think it's something that Vaughan said in the beginning about the mentorship. So don't be afraid to look for experienced researchers who can serve as mentors, and they can provide guidance to clinicians to support their research skills and their confidence. So it has to be a both way of formal education, but also some of the more informal ways, because not everyone wants to do the formal pathway further from their first degree.
Yeah. So on last question for myself was linked nicely to a question that we've just had from the audience. So I wanted to ask the panel what the current research sort of priorities are, but we've also got the question from Lindsay Mann, who says, I work for a trade union. Please can I ask, is there a way for us to find out what current research is being carried out and therefore input or help provide participants?
Great question. Certainly, so when I think about work and health research, one of the key stakeholder groups is our patient, public and employer representatives, and part of that group is actually the trade unions as well. In terms of research priorities, there's been numerous studies that have been undertaken in recent years to identify what the priorities for work and health research are in the UK. So there was a piece of work that Ewan MacDonald and Druska up in Glasgow had undertaken a few years ago, I think back in 2018, that was a Delphi study to try and identify what the priorities are. My colleague, Professor Ira Madan, she hosted a session at FOM back in 2019, again to try and scope out and identify what our priorities in occupational health and work and health research are. Essentially, they are quite broad, I guess, and they reflect the diversity of work that we do within occupational health and related fields as well. So we work particularly around interventional studies. So this, one of the priorities that we've identified is around supporting shift workers and also people with long-term health conditions who may be at risk of falling out of work. We have been involved in recent years in other studies looking at interventions to support people back to work if they've had periods of absence in the from the workplace due to ill health as well. So we know what the priorities are. Part of the challenges we've mentioned throughout this session today is actually identifying some funding opportunities to support us to do some of this research, but we have that commitment from the government and also from the NIHR to support us in doing some of this stuff.
Thanks. Ali, have you got anything you'd like to add to that?
Yes, I mean, I was going to actually give the same answer to the last two questions. I didn't get the chance, so I recycle it to this one. I mean, obviously, one referred to Ewan's research, Delphi research, and then Ira's session. So we know what the priorities are. What I want to say is actually just going back to what I said earlier is about simplifying the question. I don't start a research, and I don't encourage any colleagues on this call or elsewhere to start what the priorities are. I start with, what is your problem? Do you have a question that you can do a research? It doesn't need to be earth-shattering going to moon. It is, just to give you an example, there is a big question going on in one of the professional forum about TB. There's another one going about hepatitis B. Nobody actually said, guys, let's do a research about it. Let's gather our data. We have lots of questions, but nobody actually goes to do a research. So my answer to all three questions, including the current one, is the priority is your priority. What is your problem? Can you do a piece of research about it? Now, if you have a question and you need somebody to help you, then it goes back to everything that Vaughan said. We've got the London Centre, we've got the faculty, we've got the National School. We've got hopefully plenty support and mentorship to aid you form a question, and if it really needs funding, to aid you write a proposal and approach somebody to fund it. But the question should come from you, and I don't think you can go to a menu to say, oh, this is mental health. I mean, we all know mental health is, long COVID is, but you can't do a research based on that. You have to identify what is your problem.
Thanks for that, Ali.
I just want to add on that these are all very important points, and specifically, what Ali has said about the clinicians to understand what are their needs, because they will work in different environments. As that's a question below for private practitioners. Everyone has their own needs. And I guess the other point for us would be, when we work in research, that there will be funding calls, that they follow some of the kind of overall priorities. So you will hear, for instance, at the moment, I'm working with Kiel and Glasgow for aging workforce and aging population and supporting people at work. But then if you think about it broadly, we have 4 generations at the same time at the workforce. So depending where you work and what are the problems in there, you might want to shift your focus somewhere else. So it's very important to, yes, look at what is out there, because the funding calls will be for these key priorities that the government probably is putting out. But you have to be quite specific on what your needs are, and support will come if you ask.
Yeah, that's great. Thank you. So I'm just aware of time. We've got some great discussion going on, and we've got some questions as well. So one question from the audience from Steve Borman, and he's asked, how do we encourage commercial providers to share research and data as they sometimes consider it to be commercially sensitive IP?
So I think that's a great question. I mean, first thing is, I don't know how much of research activity actually happens within the commercial sort of sector. I would imagine that there is a sizable one. The barrier, as Steve mentioned, is about the IP and the commercial sensitivity. However, I think if you think about at least the published research, I don't think a lot of them offer something that can make a huge difference from a commercial perspective. So I guess if you put the benchmark into a publication, you normally have to comply with certain framework and regulation, which means that your research would be protected from an IP perspective. So I would say that's my first point of call, to see if I was going to publish it, what I need to do to make sure my interests are protected. The second one is, I think from a funding point of view, obviously you cannot attract any funding unless you have a proper ethics and confidentiality and development approval in place. And if that has been done, I guess that should also protect your interest. So a lot of the ethics and research and development is not necessarily about the confidentiality of the subject. It is also about your IP and your sort of interest. So I guess at the planning point, if you've been through that rigorous exercise of research development and ethics approval, that should sort of set the scene for future publication. I would say finally, this might be a bit naive, but I can't certainly remember any occasion that a commercial provider published a piece of research and they lost their interest or they were harmed commercially by it. So I guess proof is in the pudding to some extent.
I suppose I can add to the mix if you like. In terms of the IP considerations, Steve does raise a very interesting point. It's something that we explore with our research partners, if you like. So we've been involved in a recent proposal, or working up a proposal involving a private provider, and the issue around IP is something that we jointly have explored with them. So who actually owns the IP that arises from research that we are involved in? Certainly research that's funded by the National Institute of Health Research, the expectation is that the IP should remain with the research team and not with the commercial entity. It is something that needs to be thought through carefully, but I don't necessarily see it as being a barrier to engaging with the commercial sector in work and health research.
Thanks, Vaughan. So we've got one last question, which I think we've probably covered, but I'll just pass it by you all. So it's from Libby, who's asking, any different guidance from those working in private sector where we have limited no links to teaching, hospitals, academic institutions? I assume the answer is going to be quite similar to as we talked about earlier around reaching out to a lot of the research institutes that are available. But is there anything else that you can add to this?
Yeah, so I would just echo what I've been saying before. So at the London Centre, we have a growing membership, if you like. We have about 40 members who work within the NHS environment, the private sector, academic institutions as well. So, you know, we would encourage people to reach out to us as a research group if people are interested in doing research. We're not exclusive to people who work within the NHS at all. You know, we open our doors to anyone who's interested in work and health research. So please do make contact with us or our other research centres.
Thanks, Vaughan. Glykeria?
Yeah, I think this is what I want to say, that the organizations, the professional networks will definitely support. So same with ACPO, you know, we'll support our members and those who are coming to us for having some articles or getting some support in the network. So I think it's about asking and making sure that you're not just postponing things, or you're not thinking that you're not going to get any responses. People are genuinely happy to support and share knowledge and research.
Thanks for that. We've had a thumbs up from Libby, so I think she's pleased with both answers there. Okay, have we got any other questions from the audience at all? Any other questions? I'll just put it back to the panel really. Is there anything from that you'd like to sort of summarise in terms of things that we've talked about today? We've covered quite a lot in terms of the different types of activities that are going on from research perspective, but also what's happening on sort of grassroots in clinical practice and how we can potentially bridge the gap between those. So has anybody got any additional points that you'd like to raise or comment on before we finish? Ali?
Yes, Nick. So probably what I would add is very much summarizing what we said before, but in a different sort of wrapped in a different layer. And that is, I mentioned about simplifying, and colleagues talked about the mentorship and where to go to get some support. One thing I would say is don't be put off by the feedback you perhaps get from the people you approach. If you say right to one, for the sake of argument, to say I want to do this, and then he comes back with 10 different questions and 20 suggestions, that is the name of the game. You know, you can't run a research unless you properly plan for it, unless you consider all aspects of it. So I mentioned it has to be simple, and I maintain that, but also don't find it off-putting if you seek support and counsel, and then it comes with something that you consider to be complicated or very hard. That is the way it is done. So I would say, in addition to everything I said, perseverance and sticking to that is also another one.
Thanks, Sally. And Glykeria?
Sorry, I was on mute. No, I think we covered most of the points, but I think this is what Ali have said, that, you know, look for mentorship, don't be afraid to support and to ask for support. And, you know, by myself, the same, I am an early career researcher, I'm putting out my grants, I need to ask for collaborations, and that's what's happening. You create your network, and then you move forward, and if you need support in whatever level you are, people around you will genuinely want to help and get involved, because after all, we want the best for our professions.
Absolutely. And Vaughan, is there anything else that you'd like to say, summarise?
I would just like to say that this has been a really useful session for us to come together and to explore some of these issues in more detail. I do wonder whether or how we go about kind of strengthening these kind of interactions, because I suppose I've been working in occupational health research for almost 10 years now, and I suppose it's quite easy to feel like we're a separate entity, if you like. So, you know, I think it's important for us to be visible and present, and to share our learnings and insights, and also just what we're actually doing at the coalface.
Yeah, absolutely. And hopefully, you know, things like today and having a discussion panel like this, where we can actually have some open, rich discussion, encourage more people to it, will help. And, you know, utilising the council really as a vehicle where we can, one, as Ali said earlier, bring different research groups together to be sharing and discussing the work, but also how we then disseminate that down through the various professional bodies, hopefully down into their members as well. So please, you know, do use it as a vehicle for that. So I think we've come to the end of our session today. So I'd really like to thank Ali, Vaughan and Glykeria for their time today, and for everybody who's taken their lunch break to come and join us. Look out for future panel discussions, and if you've got any feedback or any further questions from today, please do get in touch. We will be sending everybody a link to the recording, so feel free to share that through your membership and your professional groups as well. And we look forward to seeing you again. So thanks very much, everybody.
Nick,
Great.
did you want me to us to stay on?
Oh, I think the others have disappeared anyway. So they're on.
We usually do, just to see if you found that went okay.
It was good. I found it. I thought it was useful. I think it would have been different if it was a bit more interactive in terms of people, you know, putting their hands up and kind of asking questions.
It's hard though, isn't it? I completely agree, but
It
with
is
actually
hard.
to do that is
It
a
is hard.
difficult thing.